Hello, future Real Deal nurse practitioners. My name is Caroline, and I'm a family nurse practitioner and one of the instructors here at FNP Reviews. In today's video, we are going to focus on identifying key words and phrases in a board-style practice question, as this is a crucial skill for tackling the AANP and ANCC exams. Understanding what details matter most, such as patient demographics, symptom patterns, and clinical clues, can truly make a difference in selecting the correct answer. If you want more practice, be sure to check out our primary care question bank, which includes over 1,000 board-style questions to help you prepare with confidence. Our QBank closely mirrors the actual exam experience with features like highlighting, underlining, strike-through, and flagging. By exam day, you'll know exactly what to expect, giving you one less thing to stress about. Thank you for tuning in, and don't forget to subscribe to our YouTube channel. Let's get started. Let's go through a case scenario where you will practice identifying the keywords and phrases that help pinpoint the correct diagnosis. A 17-year-old basketball player went in for a layup and immediately experienced severe knee pain along with a sudden popping sensation. The player was unable to bear weight on the affected leg and had to be helped off the court. Within an hour, the knee became swollen and movement was significantly restricted. So go ahead and take a moment to identify the key words and phrases that will guide you to the correct diagnosis. So feel free to pause the video if you need to and focus on the details that matter most in this scenario. The key words and phrases that jump out to me in this scenario include basketball player. So the injury suspected in this scenario is common among young athletes. Also, immediately and severe knee pain. Well, this suggests an acute injury. Now, a sudden popping sensation. Well, this is a classic symptom for the injury suspected in this scenario. Unable to bear weight and had to be helped off the court. Well, this tells us that there is significant structural damage and instability in the knee. And within the hour, and swollen. Well, rapid swelling is characteristic of the injury described in this scenario. So now that we have broken down those keywords and phrases, let's put it all together. What is the most likely diagnosis based on this scenario? If you were thinking about an anterior cruciate ligament or an ACL tear, you would be correct. I know many of you were probably choosing between an ACL tear and a meniscus injury, which is why it is so important to focus on those keywords and phrases. As I mentioned earlier, the hallmark signs of an ACL tear include a sudden popping sensation, immediate pain, and rapid swelling within the hour. The fact that this patient in the scenario had to be helped off the court is another strong indicator, as it suggests significant knee instability. On the other hand, a meniscus tear often causes delayed swelling for several hours to a day. Patients with this injury can often finish their activity as they typically retain some ability to bear weight initially. Meniscus injuries are also more likely to cause persistent locking or catching rather than a distinct pop at the time of the injury. Quick knowledge check. What are the names of the two tests that can be used to assess a torn ACL? You've got it, the Ligament test and the anterior drawer test. Excellent work. We hope that you all enjoyed this video, and if you're interested in learning more about how to pass boards, be sure to check out our review courses. To pass boards, you will need to learn how to identify those keywords and phrases in practice questions, and our QBank helps you do just that. But remember, practice questions are just one piece of the puzzle. You also need a strong understanding of the content. And if you're looking for a supportive community of students prepping for boards just like you, be sure to check out our Facebook group. Links to these resources can be found in the description. And here are our references. Well, everyone, thank you so much for watching and allowing us to be part of your journey to pass the AANP or ANCC board exam. You are now one step closer to becoming a confident and competent new graduate nurse practitioner. Keep up the amazing work. You can do this.